Good evening, everyone. After so many days, again we are back with a live session. Um, Today's topic is very important considering what we are dealing with. Um, Not like the recent one. The current topic is about anemia, which is very common in India, and currently we are going to talk something about how we are going to approach these cases of anemia. In India, anemia is very common. You would have seen many cases of anemia, and as a doctor you need to know like how to work it out. And today we are going to touch basics on it. Before we move to the actual topic, let's see what is there for me. Okay. So in my profession, when I see a case of anemia, there is a structure that we follow to evaluate anemia. Many times, when patient comes to us, they come with incomplete reports or partial evaluation of the anemia, or with reports which have like excess of reports but not the relevant ones. So today's session we're going to touch the basics so that you get the concepts clear, making your way ahead to approach how to approach an anemia clear. Okay, so we will move to today's concepts. So I will start sharing the screen now. So the topic today is titled Discover the Yin and the Yang in the World of RBCs, or the red blood cells. So first, a few lines about the Yin and the Yang. Well, this is the ancient Chinese philosophy, which explains the balance in the nature using dualism as a one of the concept. Um, for example, fire and water, like that in nature, everything balances. Okay, and that's what the philosophy speaks about, how the nature tries to maintain the balance with opposite or contradictory forces. Now what we're going to do is use this to derive the mechanism in which the body maintains the homeostasis in the red blood cell counts. Okay, which is essentially an important part of anemia, where the circulating red cell mass decreases. Okay, so little bit of basic again. I have skipped few things. If you go through a proper procedure of hematopoiesis, where a stem cell is finally forming into a red blood cell, there are many steps in which immature cell becomes a mature RBC. But I've taken the last part of the lineage, which is relevant to this discussion. So what you see here is an example of a bone marrow, a bone here, femur, uh, where the adult hematopoiesis takes place. And next thing is the last part of the lineage, which is and less of blue. Okay, so you see this process. This is important for you to get a little. Currently, today, what we're going to discuss, you need to have a grip on this. So it's an erythroblast with nucleus, reticulocyte with retained chromatin material, and then the red blood cell. Where the transition happens from more of blue to more of red. Okay, so the yin and yang in the RBC word, the red blood cell count word is there is synthesis and destruction which is continuous. In your body and mind, daily the red blood cells are destructed, and daily new blood cells are given birth to and released into circulation. Okay, and now any imbalance in this will lead to anemia or polycythemia. Well, today we're going to discuss only the approach to anemia, so we will only limit our discussion to that. So synthesis and destruction, these are the yin and yang inside the RBC world. So let's see what causes anemia. What is that imbalance that is causing anemia? Okay, so you see like anemia can happen if there is increased destruction or there is decompensated production. Just a second. Okay, sorry for that. So in anemia, either the result of resultant anemia is due to either increased destruction of the cells or decompensated production. Please observe the word, it is decompensated production. Like when there is increased destruction, the body tries to balance it by increasing the number of cells, increasing the production. So when that happens, there should be no anemia if there is compensation. Only when there is decompensation, that's when anemia happens. So this is one. What else can cause anemia? Decreased production and normal destruction. There is no process like decreased production, so there will be decreased destruction of cells. This fairly the lifespan of the red blood cell is 120 days, and it is not going to increase unless it is released immaturely into the circulation. Once it is released immaturely, then it matures. So the duration adds to the total lifespan of 120 days. Why this is the red blood cell has no nucleus, it has no other extra material forming process inside the cell. So once the red blood cell is maturely released, after that it has a fixed lifespan of 120 days approximate. So that cannot be changed. Okay, so they will undergo normal destruction, or the anemia could be due to both. There is decreased production as well as increased destruction. Okay, which is little less common but not impossible. Okay, so let's see how to approach this anemia. So there are investigations which I said like I would see. So what are the ways I come across the investigations? There are sometimes complete blood count, and then I will see iron profile. Okay, or complete blood count, and directly I will see reticulocyte count. Well, to tell you, they are not wrong. Maybe many times you will start making diagnosis of anemia with those reports, but they are not the it is not consistent with accurate diagnosis every time. There are times where you may miss the diagnosis, or you may mistake diagnosis one for other. Okay, so we will see like how to approach this anemia in the first hand. On what you see on the slide, these are the basic things required to start the process of evaluating anemia. If you don't have any of this, then you are actually not doing it the way it is meant to be done. The three investigations that are absolute basics to approach anemia case is complete blood count, peripheral smear, reticulocyte count. Okay, and mind you, I'm not taking into consideration the clinical symptoms, all those things which could be non-specific for a patient with anemia. Unless the cause of anemia is, like for example, a patient with kidney disease having anemia may have symptoms relevant to renal system. Okay, so I'm not using the clinical parameters to diagnose anemia here, only the laboratory evidences. So how to approach anemia in a patient laboratory wise? These three reports: complete blood count, peripheral smear, reticulocyte count. If you have complete blood count and reticulocyte count, maybe you will start making it, but it's not accurate. I will tell you why. If you have complete blood count and peripheral smear, sometimes peripheral smear gives a direct evidence. Sometimes reticulocyte count gives a indirect evidence. So how to approach anemia in a patient with anemia? So this one is a reticulocyte and this is a red blood cell. Okay, and the duration here 24 to 36 hours. That is the time that the reticulocyte will spend in circulation, after which it will transform into a red blood cell. So what happens during this 24 to 36 hours? It starts to slowly lose the retained chromatin material, and then it becomes a complete red blood cell. After which its lifespan of 120 days will begin. Okay. So essentially, what you can say is in circulation, the lifespan of a reticulocyte count is 1 day, because after that it is going to become a red blood cell, which is going to have a lifespan of 120 days. Okay. So now few more things that we can observe from here, knowing this knowledge. So if you look here, after 120 days, it's going to get destructed. 121, just though the body doesn't function exact way, let's assume for the sake of discussion, On day 121, this RBC is not going to be there. It's going to be destructed. So for your body to maintain a homeostasis, the yin and the yang, the same amount of the cell has to be available. Okay, so the percentage of loss should be equal to the percentage of gain in any given day. Okay, so how would you get that? So this is the daily replacement value. So every 121st day, like if you take the 120 days, every day RBCs were produced and every day reticulocyte counts are produced one day prior to as reticulocyte count, and on the 121 day they are dying. So the daily normal replacement would be 0.8%. How you get this number? 1 is to 120, like 1 divided by 120 days. Okay, this will be the daily replacement of the circulation by reticulocytes. Okay, now we are going to come into concept called reticulocyte count, which is again expressed in percentage. How we are going to get this, like why 0.8% is what is replaced in circulation, but you get a normal reticulocyte count as 1 to 2%. Well, the answer is it is done by a pathologist looking at the microscope, trying to identify the number of reticulocytes in a in a slide which has full of red blood cells, and is trying to identify reticulocyte. Okay, so accounting for this aberration and individual to individual variability, the normal reticulocyte count could be taken as 1 to 2%. Here, I would like to stress something. Many times, it's the incompleteness is in the question when we are asking someone, or when the question is asked by an examiner. For example, if I ask you what is a normal reticulocyte count, and if your answer is 1 to 2%, mostly we will agree, but actually the question is not fully accurate. The question should be, what is the normal reticulocyte count in a non-anemic individual? Yeah, I'm repeating that again. If I ask you what is the normal reticulocyte count, you saying 1 to 2% may be fully inaccurate. And mostly the question is asked keeping something in mind. Like, the question should actually frame like this: what is the normal reticulocyte count in a non-anemic individual or a normal individual? Only then the answer is 1 to 2%. Why? Because in anemia, depending on the type of anemia, the reticulocyte count might increase or decrease. Okay. For example, if the anemia is due to peripheral destruction, then the marrow is going to release more cells into circulation, and the reticulocyte count is going to increase. That time, the normal reticulocyte count should be elevated, in an anemic population. So that's why the question should be, what is the normal reticulocyte count in a non-anemic population or a normal population? Okay, so let's get back to again the approach. So let's see, one thing I discussed was what caused anemia was increased destruction, right? Like hemolysis. Well, the definition of hemolysis, just a thing, it's not destruction, the anemia caused by destruction of RBCs. You can't phrase the sentence as anemia due to increased destruction of RBCs. Okay. The more accurate definition for hemolytic anemia is anemia due with red blood cells with lifespan of less than 120 days. You will have to give it a thought to get this definition. It is not increased destruction, it is uh, anemia due to decreased lifespan of RBCs to less than 120 days. That would be more accurate definition for hemolytic anemia. Okay, so getting back to the slide again. So increased destruction, and then you see like it is tipping towards anemia, and there is increased production of blood cells from the marrow, which tries to balance it. When it is not balanced, decompensated production, only then there is anemia. If it compensates, then there will be no anemia. Then this will tip to normal. Okay. Or the anemia can be due to decreased production, and there is going to be normal destruction. Remember, I told you there is decreased production. It doesn't mean that cells will now live longer than 120. There is no nucleus, so they're going to die after the products inside the cell are going to be used up. Okay, so let's look at how are we approaching. See, the complete blood count gives you the actual percentage numbers. We are not going to discuss much on that today. Peripheral smear will give you direct evidences, whether it is macrocytes, microcytes, or other abnormal cells. We are not discussing that. Today what we're going to discuss is the reticulocyte counts. Okay, and the yin yang in the word of RBCs. So let's look at this as a normal peripheral smear. So see a normal. This is I have made this with pasted RBC, so they will all look more uniform. So don't worry about it. So this is a normal. Consider this is a normal smear. You are seeing all the RBCs and two reticulocyte counts. I've placed them together now for the sake of and ease of explanation here. So you see all the RBCs and two reticulocytes here. Consider this is normal. Okay. So now you see like now the reticulocyte counts increased from 2 to 6, right? Now what does it indicate? It indicates reticulocytosis, which indicates increased production from bone marrow, obviously, right? So now, can it be simple? Like, can we just make it simple now? Like, for example, this is a patient with blood smear showing two reticulocytes. This shows more reticulocytes. Does that mean that this patient has anemia, which is compensated by marrow, or does it mean that this person has a very good functioning bone marrow? So if there is anemia, it is due to some other reason. Well, this is not that easy to understand with these two explanations. Let's go a little front. So again, this is a normal smear. There are red blood cells and two reticulocyte counts. Well, see, if you look at this slide, nothing has changed. Normal, and you look, the total count has remained the same. Only the reticulocyte percentage has increased. Okay. So we are talking about approach to anemia. In anemia, this picture is not going to be like this. So if this is the normal picture, in anemia, the picture is going to be like this. Okay, which produces inherently false high reticulocyte count. So just observe these two slides again. This is a normal, which has red blood cells. They are like distributed all over, and then you see two reticulocyte counts here. Okay, and then you have anemia, where the red blood cells disappear now. Few of the red blood cells disappear, and there are two reticulocyte counts. And if you look, the reticulocyte count is expressed in percentage. Normal is 1 to 2% in non-anemic or normal individual. It is expressed in percentage. Okay, so if you look at the percentage now, even if there is no marrow response to anemia, okay, you see false high reticulocyte count percentages. Okay, I think you see that, right? Normal cell with 2, now percentage will be like, consider it's X. Now, if you look at this, the percentage will be more than X because the red blood cells have come down. Though the marrow has not responded by increasing the production of cells, though the same amount of reticulocytes are there, still the percentage is shown as high. Okay, and this is something which needs to be corrected when you're actually looking for the reticulocyte response from the bone marrow. So first thing you need to correct is for anemia. So let's see how you're going to correct that. So that you are going to get the reticulocyte count from the complete blood count, and after that you have to correct it using the first correction, which is you're going to multiply by patient's hemoglobin divided by normal hemoglobin. This is the first correction factor. You're going to multiply it by patient's hemoglobin by normal hemoglobin. Okay, and that would be patient's hemoglobin divided by 15. For the sake of calculation, the normal hemoglobin is taken as 15. Okay, so this is just the first step, the first correction. Is there any other correction that we need to make? Yes. So let's look at this again. Again, anemia is there, so the cells have decreased, and this time you can see instead of 2, the marrow has responded. Okay, there are more number of cells with chromatin material, so marrow is responding. Now the thing is, you can see why again falsi will be there is because if you in the beginning I told you for the reticulocyte count to mature into RBCs, it takes 1 day. So the lifespan of this reticulocyte count would be 1 day. But consider like the marrow is now functioning, hyper responsive, like giving like more production, and they are releasing more cells prematurely to compensate for anemia. So this reticulocyte, you see a difference in this. It has started losing the chromatin material more. Like this is lost more chromatin material than this. So for this cell to mature into a RBC, it will take maybe 1 day and then 2 days. Okay, so what would have normally seen like only these kind of reticulocytes which would mature in 1 day. Now there are reticulocytes which have increased, and which have really been pre-released before they adequately mature, which are taking now 2 days. So this cell becomes like this in 1 day, and again afterwards again it takes one more day. So basically it has made 2 days. So if there is daily release of such cells, you will see cells which are now lasting for more than a day. So for that also you need to make a correction. Okay, so the second correction how you're going to make is you're going to divide it by 2. Okay, so basically because they are going to stay as reticulocytes in peripheral smear as for 2 days, so they'll be count like yesterday's release and today's release will be counted as today's reticulocyte count if you don't do this correction. Well, the correction factor can be 1, okay, or 2 or 3 depending on the range of hemoglobin when you're trying to correct the hemoglobin reticulocyte count. Um, but for most of the patients who are clinically coming to us, for them the number chosen is 2, okay, just to make it simple. If in severe case of anemia, sometimes we may have to make the number 3, okay, as the correction factor, but mostly using number 2 will give a sense of what's happening with the body and what kind of anemia it is. So though the correction factor may range from 1 to 3, commonly used determinant for the second correction is multiplying the reticulocyte count by half. Okay, so this is the second correction. So how will the actual formula look like? Corrected reticulocyte count is equal to reticulocyte count into patient hemoglobin divided by 15 into half. Okay, so now a few more things about this. Some you can use either patient hemoglobin by 15 or you can use patient hematocrit to normal hematocrit. That time the number would be here, you would replace it by patient hematocrit value, and this will be instead of 15 it will be 45, which is taken as a normal hematocrit. Okay, so you may find books with formula as corrected reticulocyte count is equal to reticulocyte count into hematocrit divided by 45 into half. Okay. Now, one more thing that you need to know, uh, there is no difference between corrected reticulocyte count or reticulocyte production index. Some books may mention it as corrected reticulocyte count, but it also means reticulocyte production index. Samely, the like short form would be like CRC, small letter C and capital R and C, and this would be capital RPI. So when you look at the laboratory reports, it may be shown as corrected reticulocyte count or the reticulocyte production index. Okay, both mean the same. So now what is like once we got this, what is now how are we going to use that to determine what kind of anemia it is? So any patient with anemia, okay, please look at this, is not a normal hemoglobin with, it is anemia with. So anemia with corrected reticulocyte count or reticulocyte production index of less than 2.5 equals marrow disorder. Why? There is anemia and the reticulocyte production index is less than 2.5. The value that you need to remember for reticulocyte count is not the actual reticulocyte count percentage of 1 to 2. You know, that is when you're evaluating anemia, what you need to remember is the reticulocyte production index or the corrected reticulocyte count, which is 2.5. The number you need to get and remember and register when you're evaluating anemia is 2.5. Okay, so the anemia with corrected reticulocyte count or reticulocyte production index of less than 2.5 will be marrow disorder. So there is hyperproliferation or maturity defect happening inside the bone marrow in the phase of production. Okay, the same way now anemia with corrected reticulocyte count or reticulocyte production index which is more than or equal to 2.5. You know, just remember this is less than 2.5 and this is more than or equal to 2.5, then mostly the anemia is due to hemolysis. So what does it mean? There is anemia and the bone marrow is responsive. The corrected reticulocyte count is more than 2.5, and that determines that marrow is producing the cells compensating for the hemolysis that is happening. Okay, so this is how you will initially approach the anemia to divide it into two phases. Either you're going to locate the abnormality either due to decreased production as in marrow disorder or due to increased destruction as in hemolysis. Okay, and a few more things that can confuse students in some details which are there in books. If not clearly observed, it may confuse you. Corrected reticulocyte count also means reticulocyte production index, but it is not the same for corrected reticulocyte percentage. So what is this corrected reticulocyte percentage? It is just the reticulocyte count which is usually expressed in percentage. you're going to multiply it by patient's hemoglobin by 15. Basically, it is the same, just you are using the first correction for hemoglobin of the patient. You know, so that will give you corrected reticulocyte percentage. Okay, this is not corrected reticulocyte count. Okay, students very often get confused with corrected reticulocyte count and corrected reticulocyte percentage and the struggle. Okay, so just differentiating that for you. Okay, and there is another way of evaluating anemia. This time it is little bit more labor for the person who is doing the reports, but it is easy to get the understanding of. For a patient with hemoglobin of 15, the normal reticulocyte count, this time expressed as cells per microliter, not the percentage. In a normal human with a hemoglobin of 15 gram per deciliter, his reticulocyte count will be approximately 50,000. This is normal. And if this person develops anemia, which is like by WHO less than 12 gram per deciliter, right? So if the patient has anemia with hemoglobin of 11, then the reticulocyte count of 1 lakh to 1.5 lakh cells per microliter suggests a normal marrow response. Okay, so just sharing with you like what I was telling earlier, normal reticulocyte count is not 1 to 2% as what we tell. The question is not complete. Here, if you look, the reticulocyte count percentage would have increased maybe to 3 or 5% or 7% like that, right? When it increases, then that is called as normal reticulocyte count for this anemic person would be 5% or 7% or 3%. Okay, so this reticulocyte count, just touching lines on that, what is this normal reticulocyte count? Okay, so for a patient with hemoglobin of 11, the reticulocyte count would be 1 lakh to 1.5 lakh cells per microliter. For a patient with hemoglobin of 8 or less, then the reticulocyte count would be close to 3 to 4 lakh cells per microliter. And in this case, you don't have to use any corrections. Okay, if you are directly getting reticulocyte count in cells per microliter, then you're going to just look at these values. And if it is like if for a patient with hemoglobin of 11, he has a reticulocyte count cells per microliter total count as consider like 50,000, then it is a hyporesponsive marrow. In that patient, he will be having a problem with the bone marrow production of the cells. So that would be hypoproliferative or maturation defect. Consider the same patient with hemoglobin of like 11, and he has reticulocyte counts in the range of 5 lakh. That would mean that there is hemolysis happening and there is anemia, but marrow is hyper-responsive, but still there is anemia, so there must be destruction. Okay, so this slide basically gives you what should be a approximate normal response of the bone marrow in terms of reticulocyte count for different hemoglobin levels. Okay, so again, just note two things. This is total and not corrected. So this is total reticulocyte count. There is nothing called corrected reticulocyte count or nothing here. It is just the reticulocyte count, and it is expressed in cells per microliter and not percentage. Next thing is, yeah, the cells and not percentage. So these two factors you need to remember inside this slide. So coming to an end, we are just looking at what again may confuse you or what you may need to register again after this session. So corrected reticulocyte count is equal to reticulocyte count into first correction, which is patient hemoglobin divided by 15, and the second correction, which is multiplying it by 2 or dividing it by multiplying it by half, or should I say dividing it by 2. This is the maturation correction for the reticulocyte, which has been prematurely released. This is for the patient's hemoglobin decrease, which will falsely show false high reticulocyte count. Okay. And next thing you need to remember is corrected reticulocyte count also means reticulocyte production index. So these two mean the same. No need to get confused like whether these two things are separate or the same. Okay. So another thing that may sound familiar but they're different is corrected reticulocyte percentage. So just remember to look at the last word. We humans tend to skip the third word when we are reading in certain, and then you will mistake a formula for reticulocyte count into what about the second correction factor. Okay. So here applying the reticulocyte count and the first correction factor gives you a corrected reticulocyte percentage. It's not called corrected reticulocyte count. It is called corrected reticulocyte percentage. And basically, if you divide this by 2, then you will get the corrected reticulocyte count. Okay. And one more thing that you need to remember is, as shown in the previous slide, reticulocyte count can be expressed in percentage, and only then you need all these things. If it is expressed in cells, then you can directly just observe the values, and maybe you will be able to guess it whether it is hyperproliferative or a bone marrow related anemia, or is it due to anemia due to hemolysis? Okay, so just like the yin and yang, when I came, I said hi. Now it is time to say the session is over. Thanks for being here with and attending this session. I hope you like this video. I'm going to stop sharing the screen now. Okay, so see you again with another session. Again, another discovery. Thank you. Take care. Bye.